my topic is predicting the length of stay among health workers in underserved communities. So this was a quantitative retrospective cohort study. Just to make it clear, before I proceed, the fact that where there are no health workers, there can be no healthcare delivery. That is why it is so important to have a study of this nature. It's also very much in line with the theme of this conference, which is Global Education, Research and Technology for Sustainable Development. So what I did there was to test predictive models in line with globalization and global education. So the recruitment of health workers in a global environment to South Africa in resolving the problem that we have of few health workers. So if I could move it down a little bit to the next slide. Okay. So I'm trying to move to the next slide at this instance. Okay. So all right. In any case, the next slide actually gives the introduction that the lack of health workforce is a global crisis, and numerous countries have proposed or implemented interventions to mitigate this problem. In South Africa, in particular, the government has tried different methods to actually mitigate this challenge. Okay, if I could just have for 1 minute to just fix the movement of the slides. Mr. Chair, so this was the introduction, just demonstrating that there's a few doctors that are working in underserved populations. 84% of the population here in South Africa uses the public health system, but there's a few doctors that are actually working in the public sector. So this paper aims to develop a predicting tool for the length of practice of foreign health workers given their demographic information. So machine learning methods are well suited for this challenge. So rather than using traditional methods, only considering one demographic on length of stay, machine learning examines all potential predictors simultaneously in an unbiased manner. If we could move to the next slide, which then speaks to the summary. Okay, so here's the summary of the study: is that we had more males, which was 981, constituting 53%, than females, who were 47%. In numbers, there were 870 that were recruited. What we found was that, which is interesting, that males stayed longer than females by 188 days. And South Africa had the greatest number of health workers, which were 381, followed by the United Kingdom, Nigeria, and the Netherlands. Doctors were the most people recruited, which was 89% of the population, and nurses were 6%, and then other health workers were 4%. If we could move to the next slide, another interesting phenomenon was that of relationship status. We saw that people who were married tended to stay longer in these underserved communities. So what? Machine learning models give us a predictive tool, an effective tool to predict the recruited health workers' length of stay. So these models can be adapted beyond the scope of demographic information. So that is information about location, income, etc. So allowing for strategic planning and optimization of public health recruitment. If we could move to the next slide. So as I stated, there is a global crisis with regard to the health workforce. Many countries are competing for health workers, and it's low-income countries that end up suffering because doctors, nurses, and different health stages tend to move to countries that actually have better GDPs and incomes. So this research examines machine learning tools that can be used by recruitment to identify health workers who can stay the longest in underserved communities. If we could move to the next slide, which is the methods that were used. So recruitment and retention data from Africa Health Placement, the total number was 13,698, which had 1,838 completers, was used to develop machine learning models that predict health workers' length of practice. And the cross-validation technique was used to validate the methods which performed the best based on the respective aggregated error rate of prediction. Length of stay was categorized into 4 groups: those who stayed less than a year, those who stayed less than 2 years, and those who stayed less than 3 years, and those who stayed more than 3 years. So 3 machine learning models were trained and used a 10-fold cross-validation techniques to attain evaluative statistics. So these were the results. If we can move to the next slide. So these are the results. So these are the 3 machine learning models used: multinomial logistic, decision tree, and naive Bayes. So the best performing module was multinomial logistics. And what we found was that the 3 modules achieved an average under the curve area of approximately 0.66, so suggesting sufficient predictive signal at the 4 categorical variables. If we can move to the next slide. If we can move to the next slide, you see that's the summary of the information on length of stay by gender, nationality, profession, and relationship status. You will see that there were more males than females. You see by nationality that South Africa had the most people, United Kingdom. But interestingly, people from Nigeria, that is health workers from Nigeria working in South Africa, stayed the longest in these underserved communities, which was then followed by people from the Netherlands and people from South Africa, and then health workers from the United Kingdom. Interestingly, also, if you see there by relationship status, you will see that married couples, married people stayed 869 days, whereas people who were cohabiting or who had partners were followed by 656, and you had single people following, and then divorced people stayed the least in these communities. So the conclusions, moving on to the conclusions, the next slide. We see that, in conclusion, machine learning models give us an effective tool to predict and the recruited health workers' length of practice. So these models can be adapted beyond the scope of demographic information, such as information about placement, location, and income. So this model will also allow strategic planning and optimization of public health recruitment. So as we see, if these predictive learning tools, this machine learning, as you know, the world with artificial intelligence being on the limelight, this can transform how we view the world as a global village, and how we can utilize the resources of healthcare workers to move to underserved or where they are needed the most. So you will see that some countries, well-resourced countries, they have a lot of health workers, but they're not being used effectively. If we could spread the health workers across the globe, there'll be an effective use of health workers. So machine learning tools are very good in predicting people who can be helpful in those communities. So what are my future steps? The next slide is that I would be disseminating this through the Public Health Association. If you can move to the next slide, please. I'll be disseminating this to the Public Health Association here in South Africa. They've already accepted the abstract for the presentation, and also on the world stage to the Royal Physicians Group, known as WONCA. So this is the epitome of public health in terms of health workforce, where different minds converge and we discuss the health workforce, especially to rural and underserved communities. So those are my next future plans. And also, I would like to recommend this to the National Department of Health here in South Africa, particularly the Human Resource Planning Directorate, as well as test this further with a larger regional sample. So encompassing 15 countries across the SADC region, tested with a larger population. And I think this is very novel and this is a disruptor. It's going to change how recruitment and human resources planning is done by government. I thank you. Thank you very much. That's the end of my presentation. Thank you for listening. Thank you for making time to listen.